Would you believe that one of the simplest habits in your bedroom could reveal a hidden problem with your heart? The number of pillows you sleep with, the way you climb a staircase, and even tiny changes in your eyes, nails, or ankles could all be silent warning signs that something is happening inside your body long before severe symptoms appear. Every day, countless people go about their normal routines believing they are perfectly healthy, unaware that their heart may already be struggling. That's what makes heart disease so dangerous. It often develops quietly, giving only small clues that are easy to dismiss or explain away. Yet those subtle signals can sometimes provide the opportunity to detect a problem early enough to prevent a heart attack, heart failure, or stroke. As a physician who diagnoses and treats heart disease every day, I've seen just how often these hidden signs are overlooked. The reality is more alarming than most people realize. Around half of American adults over the age of 40 may already have some form of undiagnosed or hidden heart disease. Think about that for a moment. Millions of people are living with heart conditions without having any idea they exist. Some feel completely healthy, while others have symptoms they simply blame on getting older, being out of shape, or having a busy lifestyle. Today, I'm going to walk you through 7 important warning signs that may point toward hidden heart disease. These are the same practical clues I look for when examining patients in the clinic. The good news is that you don't need years of medical training to recognize many of them. You can start looking for these signs right now, and understanding them could one day help protect your own health or even save the life of someone close to you. Let's begin with a question that usually surprises people. How many pillows do you sleep with each night? At first, it sounds unrelated to your heart, and many patients smile when I ask it because they don't see the connection. However, this simple question has become one of the most valuable ways to uncover hidden heart failure. The real question behind it is much more important. Can you lie completely flat in bed and breathe comfortably, or do you become short of breath unless your head is elevated? To understand why this matters, it helps to know what your heart is supposed to do. Your heart constantly pumps blood from your lungs to the rest of your body and then back again. When the heart begins losing its ability to pump efficiently, blood can start backing up into the lungs instead of moving forward as it should. As pressure inside the lungs' blood vessels increases, fluid slowly leaks into the surrounding lung tissue. While you're standing or sitting upright, gravity helps keep much of this fluid lower in the lungs. But when you lie flat, gravity no longer keeps the fluid in one place. Instead, it spreads more evenly throughout the lungs, making breathing much more difficult. Imagine trying to breathe while a thin layer of water is slowly filling the tissue that should be exchanging oxygen. Every breath requires more effort, even though nothing appears wrong from the outside. Doctors call this condition pulmonary edema. On a chest X-ray, it often appears as white cloudy areas where fluid has collected inside the lungs. While the images clearly show what's happening internally, patients rarely experience such a dramatic change overnight. In fact, one of the biggest challenges is that this process usually develops so gradually that people hardly notice it happening. They don't suddenly wake up unable to breathe. Instead, they begin making small adjustments without thinking much about them. Perhaps they start using one extra pillow because it feels a little more comfortable. Months later, they add another pillow. Before long, sleeping flat feels impossible. Yet they assume it's simply become their preferred sleeping position. Over the years, I realized that asking patients whether they felt breathless while lying down often didn't produce useful answers, because many had adapted so slowly they no longer recognized the symptom. That's why I changed the way I ask. Instead of focusing on breathing, I simply ask how many pillows they sleep with. Surprisingly, that straightforward question often reveals far more than a lengthy medical questionnaire. So tonight, before you go to bed, ask yourself something simple. Could you comfortably sleep completely flat without feeling short of breath? Or have you gradually become dependent on several pillows just to breathe comfortably? It may seem like a small detail, but sometimes the smallest details provide the biggest clues. Even when the heart begins to weaken, many people continue living what appears to be a completely normal life. They go to work, shop for groceries, walk through their neighborhood, and complete their daily routines without noticing anything unusual. That's exactly why heart disease can remain hidden for years. The body is remarkably good at adapting, allowing people to function despite a gradual decline in heart performance. I've cared for patients with significant heart disease who could still walk a mile without stopping and insisted they felt perfectly fine. If I had only asked whether they could walk around the block, I might have missed the warning signs entirely. But there is one simple activity that often tells a very different story. Climbing a flight of stairs demands much more from the heart than walking on level ground. As you climb, your muscles require more oxygen, your breathing naturally becomes faster, and your heart must pump harder to meet the increased demand. A healthy heart responds without much difficulty, but a heart that is beginning to struggle often reveals itself during these moments. If you regularly find yourself unusually out of breath after climbing just one flight of stairs, especially if this represents a noticeable change from what you could do in the past, it deserves attention. Many people dismiss this by blaming age, weight gain, stress, or simply being out of shape. While those factors certainly can contribute, they should never be used as automatic explanations. Sometimes the earliest evidence of heart disease only becomes visible when the heart is challenged beyond its usual workload. Paying attention to changes in your exercise tolerance can provide valuable information long before more serious symptoms develop. The next sign is one you can check in less than a minute without any equipment at all. Take a close look at your ankles and lower legs. Have you ever noticed that your shoes seem tighter by the evening than they did in the morning? Perhaps your socks leave deep impressions around your ankles after a long day, or maybe you've noticed swelling that seems to come and go. Many people ignore these changes because they assume standing too long or the weather is to blame. Sometimes that is true, but persistent swelling can also point toward an underlying problem with the heart. When the heart cannot pump blood efficiently, pressure begins building inside the veins. As this pressure increases, fluid escapes from the tiny blood vessels into the surrounding tissues, where it gradually collects. Gravity causes much of this fluid to settle in the feet, ankles, and lower legs, making swelling especially noticeable by the end of the day. Doctors often look for something called pitting edema, and it's surprisingly easy to check for yourself. Press your thumb firmly against the skin over your ankle or shin for about 15 to 30 seconds. Then remove your thumb and observe the area carefully. If an indentation remains for several moments before slowly returning to normal, that is known as pitting edema. What you're seeing is excess fluid trapped within the tissues. It reflects the same basic process that can occur inside the lungs during heart failure, except here the fluid is collecting beneath the skin instead of inside the lungs. Of course, swollen ankles alone do not prove heart disease. Kidney disease, liver disease, pregnancy, certain medications, and several other medical conditions can produce similar swelling. However, when ankle swelling appears together with breathlessness, difficulty lying flat, or reduced exercise capacity, it becomes a much more important clue that deserves proper medical evaluation. Now let's look at something your body is constantly revealing without you even thinking about it: your pulse. Every heartbeat sends a wave of blood through your arteries, and with nothing more than your fingertips, you can sometimes detect a rhythm problem that significantly increases the risk of stroke. Place 2 or 3 fingers gently on the thumb side of your wrist until you feel your pulse. Don't focus on how fast it's beating at first. Instead, pay attention to the pattern. Does each beat arrive with a steady, predictable rhythm, almost like the ticking of a clock? Or does it seem random, with no consistent timing between one beat and the next? If your pulse feels irregular and unpredictable, it could suggest a condition called atrial fibrillation, one of the most common heart rhythm disorders worldwide. To understand why this matters, it helps to picture the heart as a carefully coordinated pumping system made up of 4 chambers. The 2 upper chambers, known as the atria, receive blood, while the 2 lower chambers, called the ventricles, pump it back out to the lungs and the rest of the body. Normally, an organized electrical signal travels through all 4 chambers, causing them to contract in a smooth, coordinated sequence. This precise timing allows blood to move efficiently with every heartbeat. In atrial fibrillation, however, that orderly electrical system becomes chaotic. Instead of contracting together in a strong, coordinated movement, the atria begin quivering rapidly and irregularly. Although the ventricles continue pumping, the overall rhythm becomes unpredictable, creating the irregular pulse you may feel at your wrist. The consequences go beyond an unusual heartbeat. Because the atria no longer empty efficiently, blood can remain inside them for longer than normal. Whenever blood sits still, it has a greater tendency to form clots. If one of those clots breaks free and travels through the bloodstream, it can have devastating consequences. Should it reach the brain, it may block an artery and cause an ischemic stroke, potentially leading to permanent disability or even death. Less commonly, a clot may travel to the intestines, cutting off their blood supply and causing bowel ischemia, a serious medical emergency that requires immediate treatment. The encouraging news is that technology has made detecting atrial fibrillation easier than ever. Many modern smartwatches and wearable devices can monitor heart rhythm continuously and alert users when an irregular pattern is detected. Even so, these devices are only tools. Sometimes your own fingertips can detect an abnormal rhythm before any piece of technology does. Taking a few moments to check your pulse from time to time is a simple habit that increases awareness of your heart's health. If you repeatedly notice an irregular rhythm or develop symptoms such as palpitations, dizziness, unexplained fatigue, or fainting, it's important to arrange a medical assessment promptly. Early diagnosis allows treatment to reduce the risk of stroke and other potentially life-threatening complications, often making a tremendous difference in long-term health and quality of life. One of the most fascinating things about the human body is that it often reveals what's happening inside long before a scan or blood test confirms it. If you know where to look, your body can provide subtle clues that point toward hidden heart problems. One area that deserves careful attention is your neck, your fingernails, and even the back of your throat. These aren't places most people associate with heart disease, yet they can sometimes provide valuable evidence that one of the heart's most important valves isn't working as it should. Inside your heart are 4 valves that act like one-way doors, making sure blood always moves in the correct direction. Every heartbeat depends on these valves opening and closing with perfect timing. One of the most important is the aortic valve. Its job is to allow oxygen-rich blood to leave the heart and travel to the rest of the body while preventing that blood from flowing backwards once the heart relaxes. When this valve becomes damaged or fails to close properly, a condition known as aortic regurgitation develops. Instead of all the blood moving forward, some leaks back into the heart with every beat. At first, the heart can compensate by working harder, and many people notice no symptoms at all. However, over time, that extra workload places increasing strain on the heart muscle. As months or years pass, the heart may enlarge, weaken, and eventually struggle to pump efficiently, increasing the risk of heart failure if the condition remains untreated. What's remarkable is that this abnormal blood flow can sometimes create visible signs outside the body. One of the first places you may notice them is in the neck. Because blood is moving with greater force and volume, the arteries in the neck may produce unusually strong, visible pulsations that seem more noticeable than normal. While subtle movement with each heartbeat can occur in healthy people, exaggerated pulsations deserve attention, particularly if they're accompanied by other symptoms such as breathlessness, chest discomfort, or fatigue. These findings don't automatically confirm valve disease, but they can provide an important clue that prompts further investigation. The fingernails can also reveal something unexpected. If you look closely at the nail beds under good lighting, you may occasionally notice tiny pulsations that seem to appear with each heartbeat. Doctors refer to this as Quincke's sign. It occurs because the abnormal blood flow created by a leaking aortic valve produces unusually large pressure changes within the tiny blood vessels beneath the nails. Under normal circumstances, these pulsations aren't visible, but when they are, they can point towards significant aortic valve disease. It's one of those classic physical examination findings that reminds us how much information the body can reveal through careful observation. There are even rarer signs that physicians learn about during medical training. Some people with severe aortic regurgitation develop rhythmic movement of the uvula, the small piece of tissue hanging at the back of the throat. This is known as Muller's sign. Others develop a gentle, repetitive nodding of the head with each heartbeat, a finding called de Musset's sign. These signs are uncommon, and most people with heart disease will never experience them. But when they are present, they can provide powerful evidence that the aortic valve is allowing blood to leak backwards. They also highlight an important principle in medicine. Sometimes the diagnosis begins simply by paying close attention to what the body is already showing us. Now let's move to another part of the body that can quietly reveal information about your overall health: your fingers. Although we use our hands every day, few people realize they can provide important clues about conditions affecting both the heart and the lungs. There's a simple test you can perform right now that takes only a few seconds. Place the nails of your index fingers together so they face each other, and then do the same with your thumbnails. Look carefully at the space between the nails. Normally, you should see a small diamond-shaped window of light where the nails meet. This tiny gap is completely normal and indicates the shape of the fingertips hasn't changed. If that diamond-shaped space is missing, however, it may suggest a condition known as clubbing. Clubbing develops gradually over time as the ends of the fingers become broader and more rounded, while the nails curve downward more than usual. Because these changes happen slowly, many people don't notice them until someone else points them out. The exact biological process isn't fully understood, but clubbing is strongly associated with long-term low oxygen levels in the body and certain chronic diseases. Heart disease is one possible cause, particularly conditions that reduce the amount of oxygen reaching the bloodstream or force the heart to work inefficiently for prolonged periods. However, it isn't the only explanation. Chronic lung diseases, certain infections, inflammatory disorders, and even some cancers can also lead to clubbing. That's why this finding should never be ignored or dismissed. While clubbing doesn't tell us exactly what's wrong, it signals that something deserves a closer look. If you believe your fingers have changed shape or the normal diamond-shaped gap has disappeared, it's wise to arrange an examination with a healthcare professional. They can determine whether the change is truly clubbing and investigate any underlying condition that may require treatment. One of the most important lessons in medicine is that no single sign provides all the answers. Instead, doctors piece together multiple clues, much like assembling a puzzle. A visible neck pulse, unusual nail pulsations, subtle changes in the fingers, or increasing breathlessness on exertion may each seem insignificant on their own. But when several of these findings appear together, they create a much clearer picture of what may be happening inside the heart. Learning to recognize these warning signs doesn't replace professional medical care, but it can encourage earlier evaluation, allowing problems to be detected before they progress into serious complications. Sometimes the difference between a routine checkup and a life-threatening emergency is simply recognizing a clue early enough to act on it. As we come to the final sign, it's worth remembering that some of the most important warnings your body gives are also the easiest to overlook. Many people spend time looking in the mirror every day, yet they rarely notice small changes that could provide valuable information about their health. Your eyes in particular can sometimes reveal clues that extend far beyond your vision. Take a careful look at your eyelids, especially the areas closest to the inner corners of your eyes. Do you notice soft, yellowish patches just beneath the skin? These deposits are known as xanthelasma, and although they are usually painless and harmless on their own, they can sometimes point toward an underlying problem that deserves attention. Xanthelasma forms when cholesterol accumulates beneath the surface of the skin. Some people develop these deposits even when their cholesterol levels are normal, so their presence does not automatically mean you have heart disease. However, they are often associated with elevated cholesterol levels, and that connection is important. High cholesterol remains one of the biggest contributors to cardiovascular disease around the world. Excess cholesterol circulating in the bloodstream can gradually become trapped inside the walls of arteries. Over many years, these deposits combine with inflammatory cells and other substances to form plaques, a process known as atherosclerosis. At first, these plaques are small and produce no symptoms at all. Blood continues flowing through the arteries, and most people have no reason to suspect anything is wrong. But atherosclerosis is a progressive disease. As plaques enlarge, they narrow the arteries and make it more difficult for blood to reach vital organs. If this narrowing occurs in the arteries supplying the heart, it can reduce oxygen delivery to the heart muscle and eventually lead to chest pain or a heart attack. If similar plaques develop in the arteries supplying the brain, they increase the risk of stroke. The same process can affect blood vessels throughout the body, contributing to circulation problems in the legs, kidneys, and other organs. This is why xanthelasma deserves more than a passing glance. While the yellow patches themselves are not dangerous, they may serve as an early visual reminder to evaluate one of the most important risk factors for heart disease. A simple blood test can measure your cholesterol levels and help determine whether lifestyle changes, medication, or further assessment may be appropriate. Detecting abnormal cholesterol early provides an opportunity to reduce future cardiovascular risk long before symptoms appear. As you've seen throughout this discussion, none of these 7 signs provides a diagnosis on its own. Sleeping with several pillows, becoming breathless on stairs, swollen ankles, an irregular pulse, unusual pulsations in the neck or nail beds, clubbing of the fingers, or yellow cholesterol deposits around the eyes can each occur for reasons other than heart disease. Many of these findings are associated with other medical conditions, and some may even appear in perfectly healthy individuals. That's why it's essential to avoid jumping to conclusions based on a single observation. The real value lies in recognizing these signs as clues rather than conclusions. In medicine, diagnosis rarely depends on one symptom alone. Instead, doctors combine information from your medical history, physical examination, blood tests, heart tracings, imaging studies, and other investigations to understand the complete picture. These visible warning signs simply help identify people who may benefit from that evaluation before a serious event occurs. One of the greatest challenges with heart disease is that it often progresses silently. Many people feel well until the moment they experience a heart attack, develop heart failure, or suffer a stroke. By then, the disease may have been developing for years without obvious symptoms. That's why paying attention to small changes in your body is so important. A gradual decline in exercise capacity, increasing breathlessness while lying flat, persistent ankle swelling, or an irregular heartbeat should never be dismissed simply because they've become part of your daily routine. The earlier heart disease is recognized, the greater the opportunity to prevent long-term damage and improve outcomes. Equally important are the habits that protect your heart every single day. Regular physical activity, maintaining a healthy body weight, eating a balanced diet rich in vegetables, fruits, whole grains, and healthy fats, avoiding tobacco, limiting excessive alcohol intake, controlling blood pressure, managing diabetes, and keeping cholesterol within a healthy range all play a major role in reducing cardiovascular risk. Routine medical checkups become even more valuable as we grow older, or if we have a family history of heart disease. Prevention remains one of the most powerful treatments modern medicine has to offer. If, while watching this video, you recognized one or more of these signs in yourself, don't panic, but don't ignore them either. Use them as a reason to schedule an appointment with your healthcare provider. A proper assessment can determine whether these findings are harmless or whether they point toward an underlying condition that requires treatment. Many forms of heart disease can be managed very successfully when detected early, often preventing complications that might otherwise change a person's life forever. Knowledge becomes truly valuable only when it leads to action. By understanding these subtle warning signs, you've taken an important step toward protecting not only your own health but also the health of those around you. You may remember a loved one who sleeps propped up on several pillows, a friend who suddenly struggles climbing stairs, or a family member who has developed unexplained ankle swelling or an irregular heartbeat. Sharing this information could encourage someone to seek medical advice before a hidden problem becomes a medical emergency. Thank you for spending this time learning about one of the most important organs in your body. I hope this information helps you recognize that heart disease doesn't always announce itself with dramatic symptoms. More often, it whispers through small changes that are easy to miss unless you know what to look for. Listen to those signals, take them seriously, and never hesitate to seek professional medical guidance when something doesn't feel right. Your heart works tirelessly for you every second of every day. Giving it the attention it deserves may be one of the most important investments you'll ever make in your long-term health. If you found this video informative and helpful, consider subscribing for more evidence-based health content designed to make complex medical topics simple and practical. Leave a comment below sharing which of these 7 signs surprised you the most, and feel free to share this video with friends and family. A single conversation about heart health could make all the difference for someone you care about. Thank you for watching, stay informed, take care of your heart, and I'll see you in the next video.